Welcome back to the Lecture 2, Part 1, Pain Throughout the Organ Systems. This presentation covers abdominal pain through musculoskeletal pain. Under the general category of abdominal pain, we'll look at pancreatitis, cholecystitis, appendicitis, peritonitis, nephrolithiasis, ovaries, and a whole lot more. Before we begin looking at the various causes of pain in the abdominal region, we need to quickly review the basic quadrants of the abdomen. If the little circle in the very center, if the little circle in the very center of the large circle is an umbilicus, not that I drew a thing in here, right here, or belly button, our abdominal quadrants are divided up into the right upper quadrant, the left upper quadrant, right lower quadrant, and left lower quadrant. In medicine, we're always looking from the patient's perspective, so in this case, the patient is standing looking right at you. So what is pancreatitis? Of course, as the name suggests, it's inflammation of the pancreas. From what I understand, this can be very painful, and it can be caused by many different factors. Alcoholism is a major cause of pancreatitis, accounting for as much as 80% of the cases in Western countries. Alcoholism can also lead to pancreatic cancer. Gallstones, called cholelithiasis, are present in 35 to 60% of cases of pancreatitis. Trauma, although much less common, can be another cause. Cystic fibrosis is a genetic disease and is directly related to pancreatitis, but we'll cover it in much more detail later on in the course. All of the above conditions can cause the common bile duct to become clogged, and the enzymes in the pancreas can literally eat itself, called autodigestion. If you remember from earlier material, the pancreas is one of the organs that causes a referred pain to the back along with the expected epigastric pain. Due to disruption in the pancreatic enzymes, nausea and vomiting is common. The inflammation is related to fever and tachycardia, tachy, fast, cardia, heart, and hypotension is related to hemolysis, or the breaking down of blood as a part of systemic inflammatory response. In fact, the systemic inflammatory response is the root cause of all the symptoms. Acute pancreatitis can be a medical emergency. Lab findings include a marked elevation of serum amylase during the first 24 hours and increased lipase within 3 to 4 days. In about 10% of cases, a patient will have glucose found in the urine. Does that make sense? You might want to pause for a second and think about it. I'm going to ask you in class about why glucose is found in the urine. A CT is pretty accurate in identifying pancreatitis because, like all conditions ending in itis, there's inflammation, and that we can see with our eyes. This little drawing just explains lipase and amylase a bit. Pause a second to read it if you want. I'm not going to pause on here very long. Inflammation of the gallbladder is called cholecystitis. It almost always occurs and associated with gallstones, and it's one of the most common reasons for abdominal surgery.